Hello, my name is Julia Lee. Welcome to my community analysis of Kenneth City. As a protest to overbearing regulations and taxes, the town of Kenneth City, named after developer Sidney Colin's son, was born. Its incorporation took place on April 30th, 1957, and what started off as 340 acres of pasture land became home to 450 residents. Within the next 3 years, some landmarks that are still here today are the city's town hall, fire station, police department, Dixie Hollins High School, and the Kenneth City Plaza, which is home to Winn-Dixie. Presently, the greatest difference since the incorporation of Kenneth City in 1957 is the growth in residents. Starting at 450, the population has grown to 4,980 residents. The town of Kenneth City is quite small, a community of single-family homes. The prominent landmarks around town are the fire station, police department, town hall, and 2 parks. The fire station is home to Engine 16, which holds a contract with the Pinellas Park Fire Department serving both Kenneth City and Pinellas Park. The only school in the community is Dixie Hollins High School. The Victory Church of the Nazarene is the only place of worship catering to those of Christian faith. Right outside of Kenneth City, however, neighboring cities offer greater varieties of options for health care access, schools, dietary needs, and recreational activities. Most of the important needs are just outside of the community, taking only a few minutes to reach by car. It is safe to say that all residents do leave the community as it is necessary to access these options. 35.3% of the population of Kenneth City is 60 years or older, compared to 28.8% countywide, and 14.9% of the town is living below poverty level, compared to 9.5% countywide. According to the article, A Poverty Simulation to Inform Public Health Practice, higher number of residents living in poverty can lead to increased risk of cardiovascular disease, poor mental health, and poor quality of life. The correlation is evident as cardiac disease is the second leading cause of death in the county, following cancer. Poverty is a prevalent circumstance associated with a myriad of health disorders and severe health outcomes. In the United States, poverty has been associated with an increased risk of uncontrolled hypertension, cardiovascular disease, stroke, in addition to poor mental health and health-related quality of life. According to Irwin, these 3 elements, enhancing community power through active involvement in local decision-making about health, educating students within the actual perspective of poverty, and increasing local opportunities by employing people from the communities of concern to serve as a means to reach those communities, may improve poverty and serve to reduce the obstinate core conditions that create and sustain poverty. Education empowerment has served as a successful public health practice model in many communities throughout the world. Considering just how small the town of Kenneth City is, it's not surprising that there are no major health establishments within the community aside from the nursing home and assisted living facility listed. However, access to hospitals, walk-in clinics, and other specialized healthcare facilities are just minutes away right on the outskirts of the community. These establishments listed accept insurance and services vary. The walk-in clinic accepts insurance and also has private pay options for those without. The health department works on a sliding scale system based on income and serves the residents of Pinellas County. The 3 specific community objectives I chose are access to health services, cancer, and physical activity. Access to health services is vital for the attainment of health equity and for increasing the quality of a healthy life for everyone. With the percentage of those living under poverty levels, on public assistance, and the number of elderly in this community, there are many barriers that may prevent those vulnerable populations from getting access to health care. Access to health services ultimately allows one to have the best possible health outcomes. According to the 2012 Florida Department of Health, cancer is the leading cause of death in Pinellas County. Many factors contributing to cancer are preventable, such as smoking, physical inactivity, obesity, and ultraviolet light exposure. The Healthy People objective is decreasing the incidence of new cancer cases in addition to illness, disability, and death caused by cancer. An interview with the town manager revealed plans for expanded walkways, designated bike paths, and access to the town's 7 lakes. Besides the small parks, it is evident and in a collaborative agreement with the town residents that more areas for physical activity in the town is lacking and needed. According to Healthy People 2020, consistent physical activity can improve the health and quality of life in people of all ages, regardless of the existence of a chronic disease or disability. The city has a contract with Progressive Waste Solutions, which offer curbside pickup twice a week. Curbside recycling is offered at an additional cost. However, there are recycling bins on the same property as the police and fire department. All common areas are well maintained, and the city has implemented community policing to help enforce code violations that include unkempt yards. Residents of the community may use reclaimed water for lawn care needs according to a schedule that correlates with their address. Some issues evident from the windshield survey and data assessment include not all homes are well kept, non-compliant residents, and the amount of vacant homes in the neighborhood. As stated before, recycling is unfortunately an additional charge. Some of the older buildings and businesses could use a facelift. Community officials can be contacted during business hours, email with a response within 24 hours, and are very accessible to the residents. I was able to speak to the town manager on a very short notice, and within 30 minutes was able to receive a return phone call for an unscheduled interview. All community officials' emails and phone numbers can be found on the Kenneth City's website. Community meetings vary. Some have greater turnouts than others. Residents are encouraged to come and speak, and council meetings are held every second Wednesday of each month. The city maintains a balanced budget. According to town manager Matt Campbell, since he has taken office, they have never exceeded or used 100% of the budget. Some areas of economic concerns are the lack of growth in businesses. Those that have come in the past typically have not done well enough to stay. During my windshield survey, there were many teenagers and young children riding their bikes up and down the roads near their homes, making it dangerous practice and an accident waiting to happen. There aren't many sidewalks either, so residents are constantly sharing roads with the pedestrians and bicyclists. The community is indeed a small one, however, there are no resources available for those who are living in the area who are in poverty or homeless. Though the upside to that is there aren't many homeless people congregating to the area, but considering the percentage of those living below poverty level, this is an area that could use some focus on. Another thing the community needs is a facelift. There have been changes in the last few years, and the last council meeting revealed more plans to come. However, there can't be growth and attraction, which can generate an increase in revenue when there is no attraction. Extra revenue can go towards some of these community needs. I prioritize these needs in the order in which they can influence the greatest needs per assessment of data gathered, windshield survey, and personal observations. The global community issue that I chose is access to health care for the elderly. For both Japan and Brazil, what has been successful is actively engaging the population and taking the time to understand their needs. Conducting monthly home visits and incorporating activities to build rapport and connection, providing follow-up care, and continuity of care are critical factors to improving health outcomes. In the interview with the town manager, there is really no specific way the community of Kenneth City is actively dealing with this problem. In my data assessment, aside from independent companies that the patient may call for services such as rides, the community offers not much more to the issue. As a community health nurse, interventions that can tackle this issue are free monthly health fairs that can offer things like blood pressure and blood sugar screenings to start. Health fairs are a great way to bring the community out and together, offering a platform for a patient. Thank you. This concludes my community analysis of the town of Kenneth City.